This is a short video presentation introducing the Fixed Patella Test for the clinical evaluation of quadriceps tendon rupture. Quad tendon rupture might be easily overlooked and misdiagnosed. Despite the very common clinical signs, misdiagnoses are frequent as reported by the literature and can range from 39 to 67%. A gap in the tendon may not always be convincingly palpable. Furthermore, the inability to raise the leg can be due to an acute post-traumatic pain, introducing the high risk of false positives. In contrast, the ability to raise the leg with the use of the medial and lateral retinaculum if they are intact, or indeed by internally rotating the foot, resulting in recruitment of the iliotibial band, might convince the inexperienced practitioner that only few fibers or possibly the quad tendon remains intact, resulting in a high risk of false negatives. Results of the repair may therefore be compromised if the diagnosis and ultimately surgical repair is delayed. There has been no other clinical diagnostic tests described to date. We introduce here a simple and reliable clinical test which is very easily reproducible and, more importantly, does not generate pain when examining the patient. The test essentially consists of starting on the contralateral unaffected side and relies on a very simple principle of isometric contraction of the quadriceps muscle, resulting in fixing the patella in its position. The patient is simply asked to contract the quads and hold it there for a few seconds while the examiner applies side-to-side movement of the patella. This results in fixing the patella, therefore the quads is intact and the test is negative. On the contralateral affected side, a similar maneuver is carried out when the patient is asked to contract isometrically the quadriceps muscle, and with the side-to-side movement we can still see that the patella is mobile due to the loss of continuity of the attachment between the patella and the quadriceps muscle. Naturally, this test has its limitation and will not function with chronic ruptures where there is significant loss of muscle activity in the quadriceps or patients who have pre-existing neuromuscular conditions. A formal study is underway in our institution to investigate the accuracy of the Fixed Patella Test in detecting quadriceps tendon rupture in the acute setting. Thank you very much for watching.